Welcome to Forum 360 on Fusion, your PBS channel. Thank you for joining us for our global outlook with a local view. I'm Ardith Keck. In our daily lives, we think and we talk a lot about our health, and we hear about and we think about catastrophic illness. Do we think about wellness very much? What is wellness? Well, one definition of wellness is the state of being in good health, especially on an actively pursued goal. Do we, as individuals, in the workplace, or as a society, work toward wellness? Do we think about wellness as much as we fear and think about illness and life-changing accidents? We're going to talk today about wellness in the workplace. Let's find out what wellness means to citizens of Summit County and what it could mean to citizens everywhere. Our guests today are Cory Kendrick, Director of Population Health at the Summit County Public Health Department, and Dr. David Peter, Chief Medical Officer, Cleveland Clinic, Akron General. Welcome, and thank you for joining us on Forum 360.
Thank you.
It's our pleasure.
Dr. Peter, what can you tell us about the current state of the merger between Cleveland Clinic and Akron General as it affects patients and their families?
So the acquisition's been fully completed. So Cleveland Clinic and Cleveland Clinic Akron General are now one. We went through an initial affiliation followed by the full acquisition. The clinic has invested over $100 million in our facilities, also in our needs. So the new emergency department, scheduled to open on July 31st, is one example of that investment. So we went from a 37-bed ED to the 55-bed ED, which is all the modern features and trauma center, et cetera. We put in a full electronic medical record. That electronic medical record, Epic, is the same record that the Cleveland Clinic is on. So it's been a major investment in the community. It's going very, very well. I think the community has received the Cleveland Clinic well. And in the Cleveland Clinic, I think consistent with today's theme, has a real emphasis on health and wellness. Healthy Choice is part of their employee health program. And the Healthy Choice program has saved the clinic over $261 million and encourages activity, proper eating, et cetera, for the employees. So
all those things we're going to talk about.
All those things.
Okay. Cory, the mission of the Summit County Public Health is to protect and promote the health of the entire community. What can your one agency do about the well-being of individuals in the community?
Well, that's a huge job, and so we can't do it alone. So we rely on our partners such as Cleveland Clinic, Akron General, SUMA Health Systems, Children's Hospital, the numerous nonprofits throughout Summit County, and grassroots citizens as well, to all come together, and employers as well is a huge aspect of trying to make the citizens healthier. So working together can be done, but no one agency can do it by itself.
Very true. As a society, we think a lot about preparing for illness with health insurance, car insurance for accidents. We even have insurance for our cell phones. Do we think enough about well-being?
Go ahead.
Whoever.
I don't think we do. I think a lot of folks put that off until it's too late or until they develop a chronic illness or a chronic condition. And really the alignment with the insurance products and such really don't promote population health, wellness, those types of things. Much better at responding to the sick care versus, say, well care. Our public programs also have some real holes as far as infant mortality, opiate abuse, some of the things that really affect a good portion of our community.
I would have to agree. Unfortunately, by the time most people find out they have a serious illness, the lifetime of behavior and choices has possibly made it too late. So unfortunately, trying to focus on those behaviors in younger citizens and catching those things before it turns into a major problem is something key to start focusing on instead of treating the illness after the fact.
Mm-hmm. We do a lot of treating the illness after the fact, and that's obviously important, but if we concentrate on wellness, we might not have to do as much. One definition of wellness is the state of being in good health, especially as an actively pursued goal. What is your definition of wellness?
Well, at the health department, we do a lot of number crunching, and one of the statistics we look at is years of life lost. And we look at the quality and quantity of life. So to us, we look at who's not thriving, who's thriving, and is there quality and quantity of life? Because it's not just important to live a long time, but it's also important to live well. And that includes having a healthy diet, exercise, social supports, healthy aging, all the things that allow you to enjoy your years as opposed to having all sorts of different issues.
Mm-hmm. What would your definition of wellness be?
Wellness would include all of that, but I would add wellness is what the person believes wellness is. And each person's definition is a little different. Major emphasis on mental health, a major emphasis on physical health, a major emphasis on spirituality where that's important. I think all of that in proportion to what that individual and the community sees as important. So everything that's been talked about is absolutely important. I would just bring in the perspective of the patient or the person.
And that's a great point. I think we all really collaborate well with our local alcohol, drug, and mental health board. And we can never forget that mental health and physical health are so closely tied together, which includes spirituality and all those things we just talked about. So that was a great point.
Mm-hmm.
And I would add to that also that the socioeconomic factors really impact health, wellness, and well-being. So if you look at the socioeconomic challenges around joblessness, homelessness, those types of things, that's a real challenge. And that's something where the only way to do that is with the community.
Mm-hmm. Mm-hmm. Talk to us about the relationship between the workplace and wellness. What's in it for companies to support wellness programs?
Well, full-time employees spend over a third of their day, 5 days a week or more at the work site. So a large amount of that time is being spent there, and there's the opportunity to engage a maximum amount of people in the workplace. In addition, most of behavior choices and things can be affected at the workplace. So it's a huge opportunity to reach out to those individuals and look for ways to make people healthier.
Absolutely.
Yeah.
So if you look at the work of the Employers for Health Consortium and what the efforts are that are being made along improving the workplace, health, wellness, well-being, it's a great place to start. The education can happen there. The assessment can happen there. The interventions, many of which are very low tech, changing over from full sugar soda to diet soda or even water, making those choices easier. Not being as sedentary, so the ability for employees to get up, walk, move around. Obesity, if you think about what's being offered as far as food choices or vending choices. So those are all things that we can impact. Fairly low tech, but definitely the workplace, important place for that to happen.
Mm-hmm.
And not only is it important for the employee, it's important for the employer and our economic system as a whole. It has a huge impact on economics, on costs, the taxes we pay, pretty much the burden on society that there comes a cost with some of these behaviors. And like take smoking, for instance. Smoking, about 1 in 5 Ohioans smoke, but it costs almost $1,000 a household in state and federal tax dollars that we each pay through household taxes to support the burden of smokers. So there's a huge economic impact to some of these things as well. So if employers can help employees stop smoking, for instance, it could help make their insurance costs lower, their absenteeism rates, their productivity increase, but also on a societal whole, it helps the burden of everyone.
Yeah. Do wellness programs have any effect on health outcomes, medical spending, which you were just talking about, and other measures, including productivity?
So the answer is yes.
Yes.
It impacts all of the above. So if you just take the business-oriented metrics, so absenteeism is reduced, productivity is improved, engagement, the ability for the employee to enjoy their work and want to be there, that's better. So that's all a part of that well-being. When you look at the societal impacts, cost, I mean, it's just healthcare cost right now is rising out of proportion to many other costs. And if you look at a program like what the Cleveland Clinic's done with Healthy Choice, or what Goodyear is doing with their employees, or what all of our Summit County agencies are looking to do, that can definitely lower the rates of diabetes, improve hypertension, help with obesity, and obesity is actually a major factor, help reduce smoking. So these are all, I think, important initiatives that come out of this type of work.
Okay. I wanted to let our audience know who we have today. We're talking about wellness in the workplace, and with us are Cory Kendrick, Director of Population Health at Summit County Public Health, and Dr. David Peter, Chief Medical Officer for Cleveland Clinic, Akron General. And welcome. And can money spur more people to participate? Many programs have trouble with enrollment. Would that help, or who's most likely to participate?
I think some of the studies have shown that providing incentives have helped enrollment in worksite wellness programs, such as flexible spending cards to defer medical costs for meeting certain goals and things like that. So I think there's definitely some evidence that points to a correlation between incentivizing those sort of programs with employee engagement.
Yeah, we know these programs work, and we know that if you build the right incentives into the programs, that you'll have high participation. So when I look at this and look at the Cleveland Clinic and what they've done with Healthy Choice, which is just one program, but it's within their employee health program. So they have 37,000 people participating. They'll save over $260 million since the inception of the program in 2009. And it's a program where folks are getting up, moving, and walking, and they can track the steps, those types of things.
Those numbers are impressive.
And that's a 30% discount to the employee for what they pay for their insurance. So that's where they can tie the employee in with that premium.
So money can talk.
Yes.
Who's most likely to participate? Those who are already healthy, or those who need improvement?
I think it's both. You get a good mix of both. I think healthy individuals kind of already have those behaviors, so it's easy for them. But the incentivization, you can talk a little bit more about, you have a much larger organization experience with that, but I think it's a mix of both.
It is. It's a mix of both. And when you look at it, for employees that already have a chronic illness, hypertension, diabetes, obesity, those types of things, smoking, to have them engage with a coach that can work with them actively so they modify the behaviors that are influencing those diseases, that's an effective strategy. And that strategy has been used by a number of programs, including the Cleveland Clinic.
The Cleveland Clinic uses coaches.
Yes.
That's a wonderful idea.
It is. And
That would
it's
have to
a
work.
support for folks that have chronic illness, helps them to get through some of the lifestyle changes they need to make. And then you really do want to pay a lot of attention to the individuals who have no illnesses at this time and keep them as well as possible, as long as possible. And we know it's not a complicated formula. It's activity, diet, sleep, stress reduction, those types of things.
From your experience, how much do employees participate in wellness programs? 100%, 50%? Do they do it?
You know, I don't actually have the numbers on that, but we know they participate, and the evidence shows when they do, it makes a significant benefit. Do you have the numbers for?
I don't have the exact numbers. I do know it's definitely not 100%. And with a well-designed program, you can approach well over 50%. But where the exact number between 50% and 100% is, I actually don't have that. But you can certainly, above 50%, it's the majority of the employees who are in fact engaged and are a part of what you're trying to accomplish, which is making their health better and then making the organization's health better.
Well, and two, I wanted to point out, while Cleveland Clinic has obviously an excellent employee wellness program, you don't have to have such a robust system to participate in some sort of wellness activity. So the Employers for Health Consortium, the group that we're in, that was put together through, started as the Akron Medical Directors Group, uses a CDC tool to allow smaller to mid-sized businesses be able to look at low-cost interventions. So it's not just the ability to have this huge, robust wellness system. There's some things smaller employers can do as well.
Worksite wellness programs experience reduced absenteeism.
Yes.
Correct? Okay. Lower, people who can control their stress have lower absenteeism.
Yes.
I would assume. People with healthy blood pressure, cholesterol, and glucose have lower absenteeism.
Yes.
So that it speaks for itself that it would be worth the company to try to do this.
Well, I want to bring this around to what Cory just mentioned, is that the Employers for Health Consortium was really the brain trust of Goodyear, Dr. Brent Pilecki, who's their chief medical officer, and he asked that all the chief medical officers for the major hospitals in Akron come together. So Children's Hospital, SUMA, Cleveland Clinic, Akron General. We also brought the University of Akron to the table, and then representatives of Summit County and the mayor's office, as well as GOJO. And that really was the nucleus for what are we going to do? What can this group do that would make a difference for the health in Summit County? Out of that grew the Employers for Health Consortium. And the focus of the consortium is, number one, to have employers participate in the CDC worksite study. And then based on that participation, to drive the improvements that they need to drive that would be most beneficial for their employees. And just like Cory said, the emphasis is on the very small employer, maybe a mom and pop shop, all the way up through the very large employers that we have in Summit County. And the nice thing about this emphasis is that it can include everyone.
And it's completely free.
Completely free.
Completely free.
Fantastic. What about little changes like bike racks or veggies in the break room or a map of walking routes? Do they make any difference?
Huge difference. We like to say make the healthy choice the easy choice. So changing the physical environment to make the healthy choice the easy choice has been shown by many, many studies to be a very strong indicator on improving outcomes. So having those things available encourages that sort of behavior, as well as even larger than that, not just only the business, but then the cities the businesses are located in. For example, the city of Akron, they're looking to redo their main street. It's going to have more walkability, bikeability, and so most cities are looking to do this, and they know that these changes not only improve wellness, but also are attractive to new businesses for this reason as well.
And Cory has examples of what the Summit County Health Department can do to support some of those. So I know like you had the bike rack program. And
Yeah, so with the National Park System, with the City of Barberton, we've installed bike shares in various areas in Summit County. We've worked with other employers to, we did have a grant available at one point to help employers install bike racks and fix-it stations and water fill stations to encourage, water drinking as opposed to pop consumption. So there's all sorts of different things that we've done with local businesses, with government, with the built environment to try to encourage the healthy choice to be the easy choice and having those things available. Something as simple as having fresh filtered water available to fill your water bottle can make a big difference when you're thinking about, that dirty old drinking fountain in the corner as opposed to the pop machine. Well, now if you have something nice to fill your water bottle up with, that might be a much more attractive option. And those things can add up to a big change. You consider a can of pop has a couple hundred calories per can. Average person might drink a couple of those a day. You knock that out, and it really makes a big impact on their overall health.
Right, right. Obviously, the Cleveland Clinic, according to your statistics, has saved healthcare costs.
Yes.
Is that a general thing for other companies?
I think it's a model for other companies. For a healthcare organization, we should lead the way as far as health, wellness, well-being, and I think the Cleveland Clinic does that. SUMA has programs that are also highly effective. Children's Hospital has programs. So this is something where it's not just Cleveland Clinic, Akron General, it's really our whole community. And with a group like the Employers for Health Consortium, we're bringing a lot of groups together. The Mayor's Office, Summit County, the school systems, the public school systems, and then the employers. I think it's that type of approach which is most likely to reach the majority of our community.
Recently, we've had two high-profile suicides, Kate Spade and Anthony Bourdain. Wellness programs can help alleviate depression and the symptoms of depression, as well as improve life satisfaction. True?
True.
True. Yep.
So that's another good reason to.
As mentioned earlier, mental health is so important. Looking at that aspect of it and making sure that you kind of recognize signs and symptoms of employees or just anyone really who might be struggling and try to get them the help they need.
And we have an outstanding resource in Summit County with the Alcohol, Drug Addiction, Mental Health Board. And if you look at our resources versus, say, some other communities, we have a lot of mental health resources. It's never enough, but we do have a lot.
They're there. Several years ago, the CEO of Macaroni Grill went on the Today Show and announced a new menu that stated calories of all dishes. And of course, they're trying to do this elsewhere. But a few months later, those menus were available only upon request. People didn't want to know calorie counts. Do we want to be healthier? Do people really want to be healthier?
Well, that's a tough question. I think, changing anyone's behavior is the hardest thing to do. It doesn't matter who you are. Trying to change behavior is really tricky. And I think people really do want to be healthier, but it's hard. And it's hard to make those choices. And I think there's a lot that goes into those choices that companies make when they look to put calories or not put calories and kind of strategize on the best way to do that. So.
I think people do want to be healthier. It is hard in the current environment with our fast food and everything so accessible, and healthy choices, so it's less accessible. So I think if you can make that choice easy, it helps.
And cost prohibitive. I mean, usually if you look at the menu, the healthiest options are the most expensive and you get the least amount of food. So it makes it difficult to sometimes make that choice. Or you may not have the ability to get fresh fruits and vegetables because of where you live. You may be in what's called a food desert, and access to a grocery store with healthy food may not be within reasonable walking distance. So there's a lot of different factors that go into that. And as mentioned earlier, the socioeconomic factors, poverty, where you live, make a huge impact on those outcomes as well.
Most wellness studies show that employees eat healthier foods. True or false?
Say that again?
Most wellness studies shows that employees in wellness programs eat healthier foods.
I think with the qualifier in the wellness programs that they eat healthier foods, I think that is true. I don't know that I would agree with it otherwise. So.
Just about anybody can have healthy behaviors for a few days or weeks. We learned today that the key is to maintain healthy behavior for years. As soon as you stop having healthy behaviors, you stop getting benefits. Dr. David Peter, Chief Medical Officer for Cleveland Clinic, Akron General, and Cory Kendrick, Director of Population Health with the Summit County Health Department, joined us today to help us understand the long-term personal and professional benefits of concentrating on wellness rather than sickness. Thank you for joining us on Forum 360 for our global outlook with a local view.
Thank you.
Forum 360 is brought to you by Electrical Impulse Communications, the John S. and James L. Knight Foundation, Hudson Community Television, the Rubber City Radio Group, an anonymous donor, the Jewish Community Board of Akron, Medical Mutual of Ohio, Blue Green, and Forum 360 supporters.